Hello, thank you for listening to this little video clip that we are going to put together for you. We are here to speak about some issues that patients might have with enteral tube feed. And my name is Shireen Bell. I'm a registered nurse, and I also teach in the nursing program at Red Deer Polytechnic. And this is in response to some clinical practicum coursework that we're doing. And I'm here today speaking with actually my daughter, Catherine Bell. And Catherine is a registered dietitian who does work with enteral tube feeds quite a bit. And she was willing to take a little bit of time to answer this one question that we have about common issues that may arise for patients when they can't tolerate a tube feed, or what are those issues, not just with the tube feed itself, but with having an enteral tube. So Catherine, anything else to say about introduction to yourself, or is that good before we get into the response?
Yeah, I think that's a pretty good introduction. I'll say that I mostly now work with pediatric patients, so that might be there's different issues you definitely see with pediatric that population versus different kinds of populations, but so I'll try to speak to the whole spectrum of
that's
patients.
nice. Thank you.
But yeah, so what's the first kind of area you want to
I
talk
think
about?
there's one really big broad question in this particular video clip that I was thinking of, and from your perspective as a dietitian working with patients who have either the G tube or the J tube, are there common issues that you see and that you have to troubleshoot with the patients?
Yeah, so I think kind of the first thing to think about is even just like the tube or the tube site itself. So things like generally sometimes you can see is just, post tube insertion. Sometimes we see patients that will have either, maybe they're not cleaning it properly after it goes in, so there's infection that can happen. Different kind of, tissue granuloma issues that can come up too as well around that tube site, causing any kind of irritation. Specifically, sometimes we'll see with pediatric patients, they grow and they get bigger, so you can actually see sometimes that they'll outgrow the size of the tube, so that can sometimes cause issues like you'll see sometimes leakage from the tube site, or again irritation because the tube is not quite the right size for that patient. Specifically, sometimes I've seen to, depending on the patient's GI anatomy and where their tube is placed, I've had some patients who have tubes that go into their jejunum, but sometimes they'll, for whatever reason, again, I work with a lot of pediatric patients, they'll grow bigger and the tubes will sometimes actually flip. So you'll have a patient who, the tube at one point was going into the jejunum and suddenly the tube end has flipped and suddenly it's in their stomach. So you have a patient that is suddenly not tolerating their tube feed, you're not really sure why. It's actually the tube positioning has changed and it's going into a different area. Those are kind of, I'd say, the main things in terms of the tube sites themselves that kind of happen and occur that might lead to some issues.
I'm thinking when you said that in relation to pediatric patients, what about the adults who have significant weight loss after they've had the tube feed? Because I'm thinking of the cancer patients that have esophageal cancer or whatever, and then they're still going through their cancer and they have a significant weight loss. Are some site issues happening like that?
Yeah, so same kind of thing with the sizing that I was talking about with pediatric patients, that sometimes that can kind of occur for people who have really dramatic weight loss, that you can see that the tube maybe not be fitting as appropriately as it was previously. Where it's actually positioned in the stomach too as well. And again, I'm kind of going back to pediatric because I see a lot of these patients, but as they're growing bigger, there's changes, it can move essentially where the positioning of the tube is. Yeah.
That's good to know. So then let's go into the feeding process itself. So whether we're doing an intermittent or a bolus feeding, once we get into the actual administering of the nutritional supplement, what kind of common issues do you see?
Yeah, so I think kind of the first things that sometimes that you'll see is GI and in a broad sense GI intolerance issues. So whether that comes up as vomiting, diarrhea, those kinds of things, abdominal distension, things like that. Reasons for that could be a multitude of factors. So one, potentially the formula itself. So there's some patients and there's lots of different formulas. So some patients, do fine with formulas that contain fiber. Some patients need different non-fiber containing formulas. In terms of, again, how broken down or digested the formula is, there's different levels to those types of formulas. So if you're thinking maybe some, patients who's had a big gastric surgery, they've had a lot of their bowel removed, maybe they're not able to tolerate a formula that's more, whole protein formula, and they need something that's more digested, just with their GI tract able to do that. Other conditions too, sometimes there's patients who say their pancreas is removed, or they have pancreatic cancer. They have issues just with the digestive enzymes to help breaking down those formulas. That's another one that can come up too as well. In terms of other GI issues, sometimes patients can tolerate different rates of the tube feed. So you talked about continuous versus intermittent. So think of continuous feeds, as running continuously over a period of time. And oftentimes when you say that, we're talking about, even up to 24 hours a day, the feed is running, versus intermittent where they're getting, bolus feeds. Sometimes there's patients who, if they're on intermittent feeds, that feed sometimes can be pushed through quite quickly, over a period of, half an hour maybe. And for some patients, they're just not able to tolerate that. And they require the feed to be infused more slowly. So sometimes with patients who are receiving, maybe cancer treatment, they're already having some kind of nausea issues that intermittent feed is going to bring more nausea to them. So they do a little bit better with continuous feeds. Again, different kind of GI anatomy. Patients with a shorter GI tract sometimes don't tolerate intermittent feeds as well. They do better on more of a continuous kind of feed rate. Those are kind of some of the complications.
So the anatomy is actually quite significant, plays a significant role in watching for some of those issues that might arise.
Yeah, so definitely, I think the patients who had significant GI resections, of their small intestine, where a lot of the absorption and of the nutrients happen. That can really impact someone's ability to break down those proteins properly. The other thing too is you think about the shorter your GI tract is, the faster things kind of move through. So you can have issues with sometimes patients. Dumping syndrome is something that you can kind of see where things are moving so quickly through that you'll see patients have a lot of issues with diarrhea, things like that. On the opposite end of the spectrum too, there's also constipation is something that can kind of come up too. So especially with patients who there's fluid issues with, so that's something to keep in mind too. If there's different concentrations of formula, so there's some formulas that contain more water for the amount of calories, so a 1 calorie per 1 mil formula, and then there's more concentrated formulas that you can get, so sometimes 2 calories per 1 mil of formula, so there's less water in some of those. So sometimes we think about, okay, we're giving this patient this much formula, but if there's issues with fluid, they're fluid restricted maybe for some reason, we're not giving them enough water flushes, and that can lead to issues with constipation too. So
cool. Well, that was a wonderful quick condensed version of some of the common issues that you might see with people who have enteral feedings. I think you've heard some terminology too, so you've heard things around anatomy. Really consider the person's anatomy, what is happening, growth or weight loss. That's also a really great consideration. There were some great terminology that you used too, like dumping syndrome. And was there any other terminology that I'm intermittent and bolus, if you need to look that up. Those are really good terms for you to understand and know the difference in the types of tube feed. You talked about different concentrations of the actual supplements. You talked about supplements that are more broken down in nature, so you have to understand that there are a variety of supplements that a person can be on, and the person can react differently depending on the type of supplement that is used, right?
Yeah.
Anything else to summarize?
Yeah, and I think just knowing where the end point of your tube is. So, if you're working with patients, understanding if they have a tube, where is the food going? Is it going, into their stomach? Is it a G tube, or is it going into their small intestine? And that's jejunal feeding, or sometimes there's duodenal tubes. Where is your tube point ending is a good thing to think about too, in terms of troubleshooting kind of what's happening, because if you have a patient maybe that's having vomiting, but they have a J tube, that most likely that food is not coming back up through there, so maybe there's something else that's going on. But that's a good thing to think about too, in terms of troubleshooting.
Wonderful. Wow. Such great refresher, and also kind of a reminder that anatomy and physiology, those courses we all took at the beginning of our programs, are really important. So thanks for watching today's video, and I hope that this was helpful to you to get a really nice broader understanding of the things that you want to look for. And stay tuned for some other clips that we're going to make along the ways. Thank you. Bye-bye.
Bye.